Hello, darlings. You've all heard of Marilyn Monroe. Some of you know Bridget Bardot. Well, now it's time for the Cognac Show. I said cognac, ooh, ooh. I said cognac, ooh, ooh, ooh. I'm your bubbly blonde, fabulously dressed to impress. One-of-a-kind girl. I was brought into this world wrapped up in pearls. I love to mingle, though my husband reminds me I'm not single. I meet and greet both the famous and the elite. I ride in limousines, drinking the finest champagne, wearing furs, dazzling diamond jewelry. A girl can't complain. I live the upscale life, dining in the finest restaurants, eating the best caviar for free. And no matter how much I enjoy myself, they can't charge me.
Here for about an hour, doing the right side, and we're about to take this applicator off, and we expect to see a nice mound of frozen fat, and over a period of time that fat will essentially melt to get you about a 20% reduction in the fat. So there may be some bruising. Any bruising that you experience will definitely go away. So this is what it looks like at this point. So this entire area is gelled, it's frozen, and we'll massage it, and as we're massaging it, it thaws out. And it's relatively painless. She may feel a little bit of discomfort for the next week or so, maybe some numbness, maybe some sort of tingling sensation. It all subsides after about 2 weeks. The nice thing about this procedure, it's safe, no needles, no downtime, 1 hour, bing, bam, boom, done. So, as I said, she may have some mild bruising, but this is all resolved. And the redness, the pinkness is just frozen skin or skin that's thawing out, and within an hour she'll be back to normal.
Hello, darlings. Welcome back. I'm Cognac Wellerlane, and I'm reporting for the Long Island Exchange.com, and I'm here with world-renowned Dr. Javier Zelaya. Did I say that correctly?
Absolutely. Javier Zelaya.
Oh, this is fabulous. We're having cocktails, and we're having an evening of Botox and Juvederm and rejuvenation and all kinds of wonderful new procedures that are on the market right now for plastic surgery. Explain to my audience, this is your patient.
Yes. This is Marissa, and Marissa, by all accounts, is an attractive, beautiful young lady.
She's gorgeous.
Yes. But Marissa has a little problem area, which are her thighs. And
you wouldn't know it, darling. You look absolutely stunning sitting there.
She's stunning. So, you know, Marissa, I approached Marissa about doing this procedure called cool sculpting, and it's sort of a non-invasive way of removing fat. You know, we apply this applicator, and she sits there for about an hour or two, and the machine essentially freezes the fat, and the fat melts over a period of time.
That's amazing.
Isn't it amazing? No needles.
The techniques that you doctors come up with, the different things, the procedures, it's just amazing. Every time I turn around, you have another procedure. I just can't keep up with you guys.
And that's a good thing.
That's a very good
That's
thing.
a very good thing.
What's next? What's next? You're gonna give us a pill and we're gonna look young again?
I think someday that'll be the case. But now we have these procedures that are, to this point, very affordable and very approachable to the common person. So it's a nice way of really sort of dealing with sort of localized problems.
Now, this procedure that you are performing on this lovely young lady, how long does this take?
This takes about an hour on each side. So typically when you're doing love handles or thighs, it's an hour on each side, and so you're looking at 2 hours.
2 hours.
2 hours, exactly.
And what are the effects? Is it permanent? Will it last a long time, or will eventually go back to the way it was?
Absolutely. Well, you have to be a good candidate for this procedure. I mean, you sit in the office for about an hour or two. It really targets problem areas that are just really difficult to remove with exercise. A muffin top, a love handle, a saddle back.
These are just a saddlebag.
Exactly.
These are things that are just not easily corrected by exercise.
Exactly, and the ideal patient is somebody who's fit, who works out, who takes care of themselves, and who is willing to sort of do that little bit of extra kind of procedure to sort of deal with these issues.
Now, you also perform, of course, Botox.
Absolutely.
And Juvederm.
Botox, Juvederm, Radiesse, and the newest neurotoxin or Botox is something called Xeomin, which we're promoting this evening.
What is that? Explain to my audience what that
Xeomin is a product, a neurotoxin like Botox that's been available now for years in Europe, and it recently became available in the States. And it's sort of, I think about it as a more purified version of Botox. And so patients find that, in theory, they're less likely to get antibodies against it, and so it tends to be much more effective in my practice.
Excellent. Well, you are just wonderful, serving your patients wine and letting them relax and enjoying this wonderful technique. And I want to thank you for this wonderful interview. Can you tell my audience where we can go to find out more information about what your procedures entail and where they can go to have any kind of plastic surgery?
We have a website. It's skinworksny.com, and our services are listed there, and our contact information is there. There are a lot of great sites online, and just make sure you go to a reputable dermatologist or plastic surgeon who offers these and who has experience in these services.
So it's skinworks.com.
Skinworksny.com.
Skinworksny.com.
You got it.
Now, do you have a Facebook page too?
I just started one last week. I'm trying to keep up with all these 20 and 30-year-olds. Marissa has certainly helped me with that, and it's evolving, and it's Skinworks Dermatology, and it's easy to find. So.
Wonderful. Is that how you found him? How did you, first of all, are you an actress or a model?
No.
You're beautiful. You should be.
Thank you very much.
Tell me, Marissa, how did you find Dr. Javier?
I actually found him through a friend that had seen him. Actually, she's here this evening and had the procedure done that I'm having. And 3 months into it, has had amazing results. So
you're here.
I'm here, but I've actually seen him prior to that as for other medical reasons as well. But I am here and I'm doing this tonight, so very excited.
Demonstrate, the injection process of Xeomin. Xeomin is the new Botox. That's how I think of it. It's been available in Europe for 6 years now. It's a more purified version of Botox. The benefit of that is that there's less risk of the user becoming used to it or developing antibodies against it. And so they're able to use it more long term. The efficacy and the duration is all the same. They're both two good products. This happens to be a newer version, more purified version. And in our office, this happens to be one of the few offices that has access to Xeomin. It's going to be available to most dermatologists and physicians after the year.
And this is my first time, so.
She is certainly very motivated. Sherry's applying a little bit of ice. The ice certainly helps relieve any discomfort, but the reality is it's not terribly painful. It's just a little prick with the needle, and That's it. The ice also helps with any kind of, bruising, and in this area it's pretty minimal.
I'm gonna bruise.
We'll see. Okay.
Okay.
Okay, ready? A little injection here. Excellent. That's the first one.
It's harmless.
Exactly. See? Try it again.
Your life is changing,
Relax.
graduating,
Close
getting
your eyes.
married, and starting a family. Our lives are full of changes.
Right. Injecting this area will just really help Sherry minimize the contraction of her forehead. So these 11s that we will develop from frowning will essentially be minimized, and doing this prevents them from getting worse. And the duration of this is about 4 months on the average. Now we're going to inject a little bit right here underneath her eyebrow. The point of doing that is to help raise the eyebrow. By injecting a little bit here, we're essentially minimizing the eyelid here, so you get a little pull from the forehead. We'll inject this side as well. Excellent. And that was it, as simple as that. How bad was it?
It was really harmless and very.
Well. Would you do this again?
I would definitely. I would do with you again.
Oh, there you
With
go. We're married for life.
I want to thank you very much for showing us this wonderful procedure. Tell the audience where we can go to find out more information about Skinworks on the internet.
Absolutely. Our website is skinworksny.com, and we have a lot of our procedures listed. There's a contact page for our viewers to sort of contact. We also have a Facebook account called Skinworks Dermatology, and we update it regularly, and we have announcements of special events, so we look forward to seeing all of you there.
Thank you, Doctor. Thank you so much. And we'll be back in a moment, darlings, with more interviews right here at Skinworks. Keep watching. Pink Champagne Kisses.
Fantasy dress to impress. One of a kind girl. It's been a Crybaby Productions, darlings.